Hi, my name is Riley McCloy, and the public health problem that I decided to do my presentation on is the West Nile virus. The West Nile virus is a mosquito-transmitted virus. About 1 in 5 people transmitted the virus show mild symptoms. These include fever, headache, body aches, vomiting, diarrhea, or rashes. About 1 in 150 infected people develop more serious conditions such as encephalitis, meningitis, high fever, coma, tremors, vision loss, and paralysis. Public health problem. The problem exists in society. Those bitten by infected mosquitoes will most likely be asymptomatic. People who experience mild symptoms can recover fully at home by taking pain medications, getting lots of rest, and keeping their body hydrated. However, hospitalization is required for those that experience severe neuroinvasive symptoms. This would often involve IV fluids, respiratory support, and other medications. Another problem is that there is no vaccination to prevent it. Although the risk of fatality is low, the goal of public health is to prevent people from being infected and improve quality of life, which would be much easier to accomplish if a vaccination was available. How the disease happens. The West Nile virus arises during mosquito season, which takes place during summer through fall. Humans are more likely to contract the virus when they spend many hours outside because they are more likely to come in contact with mosquitoes. Birds can contract the disease from feeding on other dead birds. Mosquitoes can contract the disease by feeding on infected birds, and they can spread the West Nile virus to humans and other animals by biting them. In very few cases, West Nile viruses spread in laboratory settings, from organ and blood donors, or from mother to infant. West Nile virus is not spread through coughing and sneezing, touching live animals or dead infected birds, or in feeding infected birds or animals. Where the disease occurs. Major outbreaks have occurred across North America, Australia, Eastern Africa, Western Europe, and Western Asia. These outbreak sites also tend to be on major bird migratory routes. Future risks for community. Global warming and climate change are factors that contribute to the West Nile virus because an increase in temperature year-round could lead to a population increase for mosquitoes. Etiological factors. The climate plays a major role in the risk of populations being infected. Mosquitoes prefer warm, wet environments and standing water, and places with higher mosquito populations are more likely to have outbreaks. Another factor is the bird population. Since the disease originates from birds, places with low bird populations or uninfected populations will result in lower impacts on the respective human populations. Who is at risk? Risk factors for developing more serious strains of the disease include the following: very young or old age, and medical conditions that compromise the immune system, such as HIV/AIDS, cancer, diabetes, kidney disease, and organ transplant. The map on the slide is provided by the CDC and shows the prevalence of West Nile virus in the United States in 2019. As of November 5, 2019, 47 of the 50 states and the District of Columbia have reported West Nile virus in people, birds, and mosquitoes. 292 of these cases have been classified as the mild symptomatic strain of the virus, while 542 of these cases have been identified as the neuroinvasive disease, meaning that infected patients have been diagnosed with diseases such as meningitis and encephalitis. How to solve the problem. Strategy 1. One of the best ways to prevent infection is to get vaccinated for a disease. Unfortunately, there is currently no vaccination for the West Nile virus for humans. Strategy 2. Another way to prevent infection of West Nile virus is to prevent being bitten by mosquitoes. Techniques for preventing bites include wearing insect repellent, long sleeves, and pants, especially during dawn and dusk when mosquitoes are most active. To prevent being bitten while at home, make sure to repair window screens and run the air conditioning. Mosquitoes prefer warmth and humidity to cold and dry environments, so air conditioning can reduce the risk of them entering homes. Lastly, it is important to remove sources of standing water, such as ponds, pots, tires, and bird baths nearby, since mosquitoes breed in these areas. Historical example. The first recognized epidemic of West Nile virus was in Israel in 1951. A total of 123 cases in a population of 303 people became infected, many of whom were young children. It was during this epidemic that many of the symptoms were described in detail for the first time, such as fever, headache, anorexia, stomach pain, and vomiting. Another historical example is the first case of the West Nile virus in the U.S. in the summer of 1999 in New York City. The outbreak occurred during a time when public health funding was diminishing and not many labs had the resources to respond to West Nile virus. This led to it spreading very quickly over the next few years and eventually spreading throughout the continent. Public health in the future. What does literature say we should do? Currently, research is being done on developing a vaccination for West Nile virus. Since there is no immunization available, the best ways to prevent the contraction of West Nile virus are to eliminate the number of mosquito vectors in the area. Strategies for this include eliminating standing water sources to prevent breeding. The other way to prevent infection is to reduce chances of being bitten using insect repellent and long-sleeve shirts. The picture shown on the slide exhibits the vaccines that are available to horses and have been proven to make the horses 30 times less likely to contract the disease. Public health in the future. In my opinion, developing a vaccination for West Nile virus is the best route towards prevention. If a vaccination was created, then the cost of other preventative measures could be greatly reduced. The risk of infection would also greatly decrease, as vaccines are a much better way to prevent infection than attempting to prevent vectors from reaching the population. Lastly, here are my citations. Thank you for watching my presentation.